thing is that when you have two parents that are fiercely independent and never wanted to be in any kind of a facility, in a retirement or a nursing home, I mean, that was never on the table. It was an absolute. And so then how do you take the next step and say, I'm going to have somebody come into my home? Because your home is such a private place, and having lived here for over 40 years and having limited mobility and a lot of other restrictions kind of developing over time, you know, how does somebody fit in? And you're a little bit maybe resistant to protect and defend against somebody coming into your home. So how does somebody come in and not only break down all of those barriers and get to the point where they are part of the family? I mean, how do you imagine that that's even possible? And yet that's exactly what's happened here. My parents are not only happy with advanced home health care services, I think they're really blown away because it's so much beyond what they might have expected. I think they thought that they would have somebody check in on them, and maybe if they ran into a problem, there would be one more person who could be at the scene when their kids, who live all over the country, you know, if they can't be here, it'd be one more pair of eyes. Well, it's so far beyond that. It's interacting with doctors, it's overseeing medication, it's recognizing any change in their physical well-being, it's monitoring, you know, the progression of memory issues, it is helping to determine whether or not it should be oral medication or patch, it's bathing. You know, there are some things that children, first of all, we're not here, but second of all, the likelihood that that is going to be a natural progression of a child-parent relationship is to help with things like bathing. This was just an answer, and we didn't even know how things were. How do you know how things are? You're not there. You don't have an idea of the private side of life, but somebody who steps in with a nursing background, they can ask those questions, they can assess the situation, and they can step in, and they can do it in such a natural way that there's no resistance, there's just appreciation. You know, I think the great communication that we appreciate is the fact that it is a detailed, I guess, debriefing of what is observed, and that is something that is helpful because we all have it uniformly. All of us can read her report, and it is always written with detail and compassion and guidance, suggestions, and kind of a roadmap for us. So we're all on the same page, and it reduces all kinds of conversation, misinterpretation. It takes any of the drama out. It just keeps us all very well informed with what's going on. And I think that we really appreciate having an outsider who's educated instead of our impression of something, because the family dynamics get in the way. You've got somebody who sees it in an ongoing way, so they really do have a running awareness, but then they also have very good perspective because they see other people in their homes at this age with similar challenges. So we know we're getting real concrete information. Things have changed and improved so much. Again, it brings me back to the point that it's unfortunate that we waited as long as we did before finding somebody like Jessica, because we didn't even know where the needs were. But not only were they identified, they were met and surpassed beyond what we could have done collectively or independently. So it is improved. We've got better communication with doctors, better awareness of medications. There were some medications that were, because my dad's vision is so impaired, that were inaccurately being taken, and you know that can lead to big problems. So there isn't any area, whether it's that you need to have something cooked for them. She's a fabulous cook. I mean, listen, the girl doesn't walk on water, she dances, and that's all we hear about. My parents are in love with Jessica. If you have family members in the Omaha area, I think that Jessica is not only, you know, just top-notch, the highest dignity in her treatment with my parents, and the greatest manner of helping. I mean, for my mother to say, she gives me a bath. Jessica trains the people that work with her, and only if there are people that she would say, these are my friends, these are the ones that have the expertise, the education, and the manner in which I know I would feel comfortable saying I would have them take care of my own parents. So if you have that kind of dynamic, then you know you've come to the right company.